The primary outcomes of my research are to provide clinicians and families and people with brain injury with the resources that they need to be able to improve their communication skills. So the clinical application of the work that I've done has extended to assessment, so thinking about how we assess these people, perhaps not relying on standardised tests, not thinking about I'm just going to do an aphasia battery or a very standardised decontextualised test, which is what speech pathologists sometimes rely on. Rather than doing that, I think we need to also be assessing people in their everyday situations and looking at how they communicate in their everyday lives and what kind of communication needs do they have. Do they need to be able to be a mother? Do they need to be able to talk to school teachers for their children? Do they need to be able to communicate for their work? And communication extends, obviously, there's spoken communication. Obviously we look at reading and writing and other forms of communication as well. Maybe somebody needs to be very proficient on the computer, and so that's something we need to look at. So it's about how we assess people, and then obviously about how we treat people. And so it's the implications of my work hopefully are to encourage clinicians working in traumatic brain injury particularly to think differently about how they treat that person with brain injury, and to include family and friends in that treatment process.